Welcome to lesson 4. Up to this point, we've talked about addiction as a disease. We've explained the neurobiology behind it, and we've examined the biopsychosocial model. So now we're going to focus on how addiction develops over time. And one of the most important things to understand as a counselor is that addiction does not happen overnight. It is a process. It develops in stages, and those stages are often going to follow patterns that we recognize if we know what we're looking for. So understanding that progression is really critical because it's going to help us to identify where a client is in their journey and then exactly how to intervene appropriately. And it's also going to help us educate our clients and our families. So a lot of people think that addiction starts when things get really bad. But in reality, it often starts a whole lot earlier than that. So if we can recognize the early stages, we have a better chance of preventing further progression. So this lesson is going to walk you through those stages in detail. And I want you to think about your clients as we're going through this. Where are they falling in this progression? Where have they been in the past? This is not just about theory. It's about real life application. And so by the end of this lesson, you should be able to clearly identify the stages of addiction and use that information to guide your work. So before we move forward, I just want to ground you in what you're going to gain from this lesson, because this is one of those topics that directly impacts how you're practicing every day. So by the end of this lesson, you should be able to identify the different stages of addiction progression, not just in theory, but in real clients that are sitting across from you. You should be able to recognize patterns that signal escalation. And these patterns are often very subtle in the beginning. And if you miss them, you miss some opportunities for early intervention. And then another important goal is application. This is not just information to understand, it's information to use. So you should be able to take what you're learning here and apply it to your assessments and your treatment planning and your interventions. And I also want you to think about how this is helping with client and family education. So a lot of our clients and families don't understand how addiction develops. And they often think that it starts when the things get really bad. But as you're going to see, it starts a lot earlier than that. So when you can explain this progression clearly, you increase insight and you're reducing resistance. And that alone can improve your engagement in treatment. So as we're going through this lesson, I want you to continuously ask yourself, where have I seen this before? I want you to think about your current caseload. Think about your past clients. This is how you're going to turn knowledge into skill. And remember, the goal here is not perfection. The goal is awareness and improvement. So progression is one of the most important concepts to understand in addiction counseling because it's explaining how something that starts so small can become something much more serious. Kind of like a small plumbing leak can lead to much greater problems down the road if you don't address it. And we know that addiction doesn't typically begin at the point where someone has lost everything. It starts a lot earlier than that, and it's often in ways that seem harmless or manageable to people. So progression refers to the gradual development of substance use over time. And this is where the frequency and the intensity and the impact of use increase. And this increase doesn't always happen in a straight line. It can happen in cycles with maybe the person has periods of improvement followed by some setbacks, but overall the pattern is tending to move toward greater severity if they leave it unaddressed. Another key part of progression is the shift in control. So in the early stages, people may feel like they are in control of their use, but over time, that sense of control often decreases. And that's not always obvious to the individual. In fact, a lot of clients continue to believe that they're in control, even as their behavior is suggesting otherwise. So as counselors, we need to be able to recognize these shifts even when the clients can't. And this is where your clinical observation is going to become critical. You're looking for patterns, not just isolated behaviors. You're asking questions like, is this increasing over time? Are the consequences becoming more significant? Is the control decreasing? These questions are going to help you assess progression more accurately. And when you understand the progression, you can intervene more effectively. So, understanding progression is not just important, it's essential for effective counseling. And one of the biggest challenges in addiction treatment is that early signs are often overlooked or minimized. Clients may not see a problem. And sometimes even professionals miss the significance of those early patterns. But these early stages are where the intervention can be most effective. So as the substance use progresses, patterns can become a little bit more ingrained and more difficult to change. And that's partly due to those neurobiological changes and partly due to behavioral reinforcement. So the longer that a pattern continues, the stronger that it becomes. And that's why timing is going to matter. Early intervention can prevent escalation, while the delayed intervention often requires more intensive treatment. Another reason that the progression matters is that it's going to help us to set realistic expectations. So if a client is in an advanced stage, expecting immediate change may not be realistic. But then on the other hand, if a client is in an early stage, there may be more flexibility and opportunity for change. So this understanding allows you to tailor your approach. And it also helps you to communicate more effectively with your clients and their families. Because when the people understand progression, they're often a lot more willing to engage in the treatment. They start to see that what they're experiencing is a part of a pattern, not just isolated events. And that awareness can be a turning point. So let's take a look at the overall stages of addiction progression. These stages are not rigid categories, but they're providing a helpful framework for understanding how substance use develops over time. So when someone's born, they're born into abstinence, and then they're in abstinence all the way up until they get to this first stage, which is experimentation. And this is where people are trying substances, often out of curiosity or social influence. And I tell people that you can stay in experimentation for a long time. I mean, you can try smoking weed in a blunt or a bowl or a joint or a bong. You can try indicas. You can try sativas. You're trying varying amounts, varying strengths, whatever, varying flavors. You're just experimenting with it. Then the next stage is regular use. And this is where the substance use becomes a little bit more consistent and they may start to form some patterns. And then after that, we see risky use, where there's negative consequences starting to appear, but the person continues to use. And then, so that stage, I call, we have social use, it's experimentation, and then social use, which is regular use, which then leads into habitual use, which is like the risky use. And then comes dependence, where we can also call this abusive use, where the body and the brain start to rely on the substance. From the risky use, it's abuse, and then it becomes dependence. And then we can reach addiction, where that use becomes compulsive, and it's very difficult to control. So it's important to remember that clients don't always move through these stages in a straight line. They can move back and forth and skip stages or remain in one stage for a really long time. But the general pattern tends to follow this progression. So as counselors, we use these stages as a guide. Not really a strict rule, but a guide. It's helping us organize our thinking and identifying where a client might be in their journey. And this in turn is going to help us to determine the most appropriate interventions for them. So the experimentation stage, this is where the substance use is starting. It's often the most underestimated stage in the progression of addiction, because at this point, people are typically trying substances for the first time, or they're just using them occasionally. And this may be driven by curiosity or peer pressure or social environments, or maybe even a desire to cope with stress or emotions. And one of the key characteristics of this stage is that the perceived risk is low. The individual may not see their behavior as problematic, and in a lot of cases, it may not be causing any noticeable consequences. And that's why it goes unnoticed for so long, or it's dismissed as just normal behavior. But this stage is important because it sets the foundation for what comes next. The brain starts to associate the substance with certain experiences. And whether those experiences are positive or relieving or socially rewarding, whatever. So these associations start to influence future behavior. So as counselors, it's important not to dismiss this stage simply just because it appears mild. This is where early intervention can be the most effective. If patterns are identified and addressed early, progression can sometimes be slowed or prevented. So I want you to think about how often the clients reflect back and they say, oh, well, it started small. And this is that stage. And while it may seem insignificant at the time, it is often where the trajectory begins. So early reinforcement is what's going to keep experimentation from remaining just a one-time event. So when a person uses a substance and they experience a positive effect, the brain is going to take note. And this is where dopamine is going to come into play. Dopamine reinforces behaviors that the brain perceives as beneficial. So it tells the brain, this is important, do it again. And this reinforcement is really powerful, especially if the substance provides relief from stress or anxiety or emotional pain. And for some people, the reinforcement's not just about pleasure. It's about relief. The distraction's important here. Relief can be just as reinforcing as pleasure, if not more so. And then over time, the brain starts to associate the substance with that relief or pleasure. And that creates a pattern that encourages repeated use. So as counselors, understanding this helps us to see why clients continue to use even when they know there may be risks. It's not just about choice, it's about reinforcement. And this is also where we can begin to introduce alternative coping strategies. If we can help clients find healthier ways to achieve relief or pleasure, we can begin to shift that reinforcement pattern. So social use is a stage where the substance use becomes more integrated into a person's social life. So this happens a lot in like group settings, like parties or gatherings or social events, holidays, whatever. And the behavior is reinforced not only by the substance itself, but also by the social environment that they're in. So if everyone around the person is using, it becomes normal and maybe even expected. And that normalization can make it really difficult for people to recognize when their behavior is becoming problematic because they're comparing themselves to other people that are around them and concluding that their use is not an issue because everyone's doing it. And this is where minimization often happens. As counselors, it's going to be important to look beyond the social context, and we need to assess the person's behavior and its impact. Social use can still progress into more serious patterns, especially if it becomes like a primary way of connecting with other people. And it's also important to consider the role of peer influence here. Peers can reinforce both the healthy and the unhealthy behaviors. So helping clients evaluate their social environments can be an important part of the treatment. So there's several risk factors that can increase the likelihood of progression during the early stages of substance use. Peer pressure is one of the most common. People may feel pressure to fit in or be accepted by their social groups. Accessibility is another factor. So when substances are easy to obtain, the barrier to use is lower. Emotional vulnerability is also important here. People who are experiencing stress or trauma or like emotional distress, they might be more likely to use substances as a coping mechanism. And then, lastly, a lack of awareness can contribute to risk because maybe they don't fully understand the potential consequences of the substance use, especially in those early stages. So as counselors, we want to identify these risk factors so that we can assess vulnerability and guide interventions. And it also helps you tailor your approach. Like for example, a client who's heavily influenced by their peers may benefit from strategies focused on social boundaries, or a client who is using to cope with emotional stress, they may need support in developing healthier coping skills. So recognizing those factors allows you to intervene more effectively. So the transition from experimentation to regular use, this is like a critical point in the progression of addiction. This is where the substance use becomes more consistent and begins to form patterns. I call this habitual use. So instead of occasional use, the person starts to use on a regular basis, like every weekend or several times a week. They're coming home and popping open a beer at the end of their night just so that they can, relax or whatever. And that behavior becomes more intentional. It's no longer just about curiosity or social situations. It becomes something that the individual is seeking out. And this is where routines start to develop. The substance may become part of the person's daily or weekly habits. And that shift's important because it's indicating that the behavior is becoming a little bit more ingrained. So as counselors, this is a key point for intervention. Patterns are forming, but they are not deeply entrenched. So helping the clients recognize this shift can increase awareness and motivation for that change. And it's also important to assess the reasons behind the increased use. Is it for social reason, emotional relief, or is it something else? And understanding the motivation is going to help you guide the treatment. So regular use, this is where we start to see a noticeable shift from occasional behavior to something that's a little bit more consistent and patterned. And at this stage, the substance use is no longer just happening randomly or only in certain social settings. It becomes more frequent and more predictable. So maybe the person starts to use on specific days, or maybe they're using at certain times or in response to certain situations. And this is where routines start to form. So, for example, maybe somebody's drinking every evening after work, or they're using substances every weekend without fail. And so, one of the key indicators of this stage is that use becomes expected. It's no longer a question of if they will use, but when. And another important shift is that the use may start to move beyond purely social contexts. So while it may have started out in the group settings, the person now uses alone, or they're in situations that are not social. And that's an important red flag. So as counselors, we want to pay close attention to this stage because it represents a transition point. The behavior is becoming more ingrained, but it still may be flexible enough to change with the right intervention. And this is also where clients may start to minimize their behavior, like saying things like, oh, it's just part of my routine, or it helps me to relax. And these statements are important because they give you insight into how the client is justifying their use. And understanding this stage is going to allow you to intervene before the pattern becomes more difficult to break. And then escalation is a natural progression from regular use, and it's driven largely by tolerance. So as the body is adapting to the substance, the same amount no longer produces the same effect. And that's going to lead the individual to increase the quantity or the frequency of their use in order to achieve the desired outcome. So this is where things start to elevate or accelerate. What may have started out as occasional use can quickly become more intense. And that person may start to seek out stronger substances, or maybe they're combining substances to enhance the effect. Another important aspect of escalation is the shortening of time between the use. So instead of waiting days or weeks, the person may start using more frequently, sometimes daily or multiple times a day. And this stage is often accompanied by a growing disconnect between the person's perception and reality. They still think that they're in control, even as their use is clearly increasing. So as counselors, this is where we start to see more significant risk. Escalation increases the likelihood of negative consequences, including health issues, legal problems, relationship conflicts, and so on. And it's going to make it more difficult for that person to stop using. This is a critical stage for intervention because the pattern is becoming stronger, but it may not yet feel out of control to the client. So helping clients recognize escalation can be a powerful step towards change. So risky use is where the consequences of substance use begin to become more apparent, but the behavior is continuing anyway. This is a defining characteristic of addiction progression. The person may begin to experience negative outcomes like conflicts with their family or problems at work or legal issues or whatever. And despite these consequences, they're continuing to use. And this is where the disconnect between behavior and consequences becomes more visible. And the person may even also start to engage in risky situations, like driving under the influence or using substances in unsafe environments. And at this stage, warning signs are often present, but they are ignored or minimized. And the person may say things like, oh, it's not that bad, or I can handle it. And as counselors, this is where we need to be particularly attentive. Risky use is a clear indicator that the behavior is progressing. And it's also a point where intervention can still be effective if we handle it appropriately. So the goal here is to help the client connect their behavior to the consequences that they're experiencing, not just in the moment, but the overarching consequences. And that requires careful communication. If the client feels judged, they start to become defensive. If they feel understood, then they're a little bit more open to change. And this stage is about increasing awareness and helping the client to see the reality of their situation. Then we move into loss of control, and this is one of the most significant indicators that substance use has moved beyond casual or recreational use. So at this stage, the person may still believe that they're in control, but their behavior suggests otherwise. So they may set limits for themselves, like saying, oh, I'm just going to have one drink, but then exceed those limits. They may attempt to cut back or to stop using altogether, but they find that they're unable to do so consistently. And this is where that internal struggle becomes a little bit more apparent. The person may genuinely want to change, but they feel like they're not able to follow through. And that is not just simply a matter of willpower. It's a reflection of changes in the brain and the behavior that make control more difficult. So as counselors, it's important to recognize this and communicate it in a way that's reducing shame. And the clients are going to feel frustrated and discouraged at this stage. They may blame themselves for not being able to stop. So helping them understand that this is part of the progression can be really validating. And it's going to help shift that focus from blame to problem solving. And this is a really critical point for intervention because, as the individual may be more aware that something is wrong, even though, they maybe don't fully understand it. And then we move into denial. This is really complex, and it's often a misunderstood part of addiction. It's not simply lying or refusing to accept reality. It's a psychological defense mechanism that's helping the individual cope with the discomfort of their situation. So at this stage, denial can take a lot of different forms. Maybe the person's minimizing the severity of their use. They say things like, oh, it's not that bad, or I don't use as much as other people. And then they rationalize their behavior by pointing to stress or trauma or external circumstances. And they may also compare themselves to others who appear to be worse off. And they use that comparison to justify their own behavior. But, avoiding responsibility, that's another common pattern. The person may blame other people or those external factors for their situation. So as counselors, it's going to be important for us to approach denial with kid gloves or with care. Confronting it too directly can lead to defensiveness and resistance. Instead, we want to just gently increase awareness and help the client to see inconsistencies in their thinking. That requires patience and skill. Denial is not something that's just resolved in a single session. It's a process that's unfolding over time. And understanding this is going to help you remain patient and consistent in your approach. Dependence is representing a significant shift in the progression of addiction. So at this stage, the body has adapted to the presence of the substance and it starts to rely on it to function normally. And when the substance is removed, the withdrawal symptoms start happening. And these symptoms can be physical, like shaking or sweating or nausea. And they can also be psychological, such as anxiety or irritability or depression. And one of the key characteristics of dependence is that the person may no longer use the substance to feel good, but rather they're using it to avoid feeling bad. And the substance becomes necessary to really maintain a sense of normalcy. And this is a critical point in the progression because it's highlighting the physical component of addiction. It's no longer just about behavior or choice. The body itself has changed. So as counselors, it's important to recognize the severity of this change. Clients may require additional support, like medical intervention, maybe, so that they can safely reduce or stop their use. And it's also important to educate clients about what's happening in their bodies. Understanding dependence can reduce confusion and it increases motivation for treatment. And this stage often marks a turning point where the individual starts to realize the seriousness of their situation. Addiction in its more advanced form is characterized by compulsive use. So this means that the person feels driven to use the substance, even when they don't want to. The behavior becomes less about choice and more about compulsion. And that's where the disease model is starting to become very clear. The person may feel fully or be fully aware of the consequences of their behavior, but they feel like they're unable to stop. And those consequences can be really severe, including the loss of relationships and employment and health or their legal standing. The list can go on and on. And despite that, the substance still remains the priority. It takes the precedent over the responsibilities and the relationships and even their basic needs. And that's not just because the person doesn't care, it's because their brain has been altered in a way that prioritizes that substance. So as counselors, it's important to approach that stage with a high level of empathy and understanding. Clients at that stage may feel hopeless or ashamed, or maybe they're overwhelmed. And your role is to provide support and structure and guidance. That's also where more intensive treatment might be necessary. And understanding the severity of this stage helps you respond appropriately and advocate for the level of care that is needed. So it's at this stage the impact of the substance use becomes widespread and it's really difficult to ignore. It starts to affect multiple areas of that person's life. Work performance may decline. That leads to job loss or financial instability. Relationships may become strained due to conflict or broken trust or neglect. Legal issues may come up as a result of the substance-related behaviors. And the overall functioning just declines. So the person may struggle to maintain their responsibilities or manage their daily tasks or even care for themselves. And this is often the stage where other people start to notice the problem, even if that person is still in denial. And so as counselors, it's important to assess the full scope of this impact. This helps you to understand the severity of the situation and determine the appropriate level of care. And it's also going to give you an opportunity to help the client really see the connection between their substance use and the consequences that they're experiencing. This awareness can be a really powerful motivator for change. I want to talk about isolation for a second because this is a common pattern in later stages of addiction, and it can significantly increase risk. So as the substance use becomes more central to the person's life, they may start to withdraw from relationships and activities that don't support that behavior. That can include distancing themselves from family or friends and support systems. Secrecy often increases as that person's like trying to hide the extent of their use. And that secrecy then further isolates them and it reduces opportunities for their support system to support them. And then over time, those healthy connections might be lost, and that leaves the person more dependent on the substance. And that creates a cycle where isolation is reinforcing the substance use, and the substance use is reinforcing the isolation. So, as counselors, addressing that isolation is critical. And maybe that involves us helping our clients rebuild their relationships or develop some new support systems, or maybe engaging in group therapy or a 12-step program or something. Connection really is the key component of recovery. And so reducing the isolation significantly can improve outcomes. So the health consequences of addiction become a little bit more pronounced as the progression continues. So physically, the body may start to show signs of decline. And that includes damage to the organs, weakened immune functioning, maybe increased vulnerability to illnesses. And then mentally, the person may experience worsening symptoms of anxiety or depression or any other number of mental health conditions. And the risk of overdose is also increasing, especially with higher levels of use or maybe polysubstance use. These consequences can be really severe, and in some cases, they can even be life-threatening. So as counselors, it's important to be aware of these risks and to take them seriously. And that might mean involving or other people, or coordinating care with medical professionals, educating the clients about the risk. We probably need to develop a safety plan with the client. And understanding the health impact of addiction is just going to reinforce the importance of timely and appropriate interventions. And one of the most important things to understand about addiction is that it's not a straight line process. A lot of people assume that the progression happens in this steady, predictable way. But in reality, it's often cyclical. People go through periods of use, and that's followed by periods of abstinence, and then they return to use again. And that can be confusing for both the clients and the families. Maybe they think things were getting better, so why did it have to happen again? And this is where understanding that cyclical nature becomes important. Progress and setbacks are both part of the process, and motivation can also fluctuate. So a client may feel highly motivated one week and less so the next. And that doesn't mean that they're not serious about their recovery. It means that they're navigating a complex process. So as counselors, we need to normalize this without minimizing it. We want the clients to understand that setbacks are possible, but we also want to help them build strategies to manage those setbacks. And this perspective is going to help reduce some of the shame and keep the clients engaged in the treatment. And it's also going to help you to remain patient and consistent in your approach with the client. Triggers are going to be a critical part of understanding both progression and relapse. So a trigger is anything that activates the desire to use the substance. It could be anything, something they see, hear, smell, taste, touch, feel, whatever. It can be emotional, like stress or anger or sadness. They can be environmental, like maybe it's a place where they used before. It could be social, social triggers involve people, like family or friends who are using substances. Maybe it's going to be important to distinguish between internal and external triggers. Internal triggers are going to come from within the individual, like thoughts or emotions. The external triggers are coming from the environment. So as counselors, helping the clients to identify their triggers is a key part of their treatment. Because a lot of clients aren't really fully aware of what's triggering their use. They may just experience the urge without understanding where it's coming from. So By increasing the awareness, you give them more control. You help them develop the strategies to manage those triggers. So this might include avoiding certain situations or building coping skills or maybe creating a plan for high risk scenarios. Triggers are not something that can be completely eliminated, but they can be managed effectively with the right support. And cravings, these are one of the most challenging aspects of addiction. And they're going to play a significant role in the progression and also the relapse. A craving's not just a simple desire. It's strong, and a lot of times it's an overwhelming urge to use that substance. I kind of explain this like, if you've been outside on a really hot day and you've been out there for a while, that strong, overwhelming urge to drink a cold glass of water, that's what the craving feels like. These urges are linked to the brain's memory of past use and the reinforcement that came with it. So the cravings can be triggered by external cues, or the internal emotions, or maybe even seemingly random thoughts. And they can come on suddenly, or maybe they're building gradually over time. And one of the most important things to communicate to clients is that cravings are normal. They're not a sign of failure. They're a sign that the brain has been conditioned. And as counselors, we're going to help clients understand cravings and develop some strategies to manage them. And maybe this includes distraction techniques or grounding exercises or maybe reaching out for support. And it's also going to be important to help the clients to understand that the craving is going to pass. They're going to feel intense in the moment, but it's temporary. That knowledge helps the clients to resist the urge to act on them. I tell my clients that craving is going to go away in 10 to 15 minutes. It's just a small dopamine release in your system, and that dopamine is going to dissipate within 10 to 15 minutes. If you can tell yourself you're going to be fine for the next 10 to 15 minutes, go do something to distract yourself, and then, see how you feel. And most of the time, that craving is gone. You don't even want it anymore. So relapse is often one of those, the most misunderstood aspects of addiction, because a lot of people view relapse as a failure. But from a clinical perspective, it's often part of the process. I tell my clients to look at relapse as a learning opportunity, because we get to learn what didn't work and come up with a new solution. It doesn't mean that relapse should be ignored or minimized, but it does mean that we need to understand it in context. Relapse usually occurs as a result of multiple factors coming together. Maybe triggers, stress, lack of support, or gaps in coping skills. It is rarely the result of a single event. So as counselors, how we respond to relapse is critical. If we respond with judgment, the client might feel discouraged and maybe they start to disengage from treatment. If we respond with curiosity and support, then we can use that relapse as a learning opportunity. What led up to it? What warning signs were present? What can we do differently next time? And that approach is going to help the client build insight and develop stronger strategies moving forward. Relapse does not erase progress. It provides information that can be used to improve the treatment plan. And helping the clients to understand this helps to reduce shame, and it increases the motivation to continue. And relapse does not usually happen without warning. There are often signs that happen before the actual return to substance use. And these warning signs can include changes in the person's mood, like increased irritability or anxiety. And it can also include behavioral changes, like withdrawing from their support systems or returning to those high-risk environments. Increased stress is just another common factor. When the stress levels rise up and the coping skills are not sufficient, the risk of relapse is going to increase. And as counselors, it's important to help our clients identify these warning signs early. That's going to allow for intervention before the situation is escalating. And it's going to help the clients feel more in control of their recovery. So instead of being surprised by the relapse, they can recognize the signs and take action. That's a key part of the relapse prevention. We're shifting the focus from reacting to the problems to preventing them from happening in the first place. So, identifying where a client is in the progression of addiction is one of your most important responsibilities as a counselor. This is going to require more than just listening to what the client's saying. We're observing patterns over time and considering multiple factors. So, we want to look at the frequency and the intensity of the use. What are the consequences that the client's experiencing? What's their level of insight into their behavior? And it's also important to gather information from multiple sources when that's possible. Maybe that includes family members or medical records or legal reports or talking to their probation officer. Clients don't always provide a complete or accurate picture, especially if there's denial present. So by combining information from these different sources, we get a more accurate assessment. And that's going to help you determine the appropriate level of care and tailor your interventions. And it's going to allow you to track progress over time. Identifying what stage someone is not just a one-time task. This is an ongoing process that we need to revisit throughout treatment. And one of the biggest benefits of understanding progression is that it's allowing you to match interventions to the client's stage. Different stages require different approaches. And in the early stages, education and prevention may be the most effective thing. The goal there is to increase awareness and prevent that future progression. In the middle stages, though, skill building becomes more important. This is going to be like developing coping skills, improving emotional regulation, addressing any cognitive patterns. And then in the later stages, more structured, intensive support may be needed. So this may include higher levels of care, like intensive outpatient programs or maybe residential treatment. It's important to avoid a one-size-fits-all approach here. What works for one client may not work for another. And by tailoring your interventions to a client's stage, you increase the likelihood of success. And this is where your clinical judgment becomes critical. You're not just applying techniques, you're making informed decisions based on a comprehensive understanding of the client. And client education is a really powerful tool in addiction counseling. And understanding progression is going to give you valuable information to share with the client, because a lot of our clients don't fully understand how their substance use developed. They feel confused or ashamed or frustrated about it. So by exploring the progression in a clear and relatable way, you can help them make sense of their experience. And that reduces that shame and increases their insight. And it also helps normalize what they're going through. When the client understands that their experience follows a pattern, they're less likely to feel alone or defective. And that can increase the motivation to engage in treatment. Like if I know where I'm at in a pattern and I don't want to go forward in that pattern, then I can learn how to disengage from the pattern. It's going to help the client take a more active role in their recovery. Because education is not just about providing information, it's about empowering the client to understand themselves and make informed decisions. And as counselors, we should be really intentional about how we're using education in our work. Family education is just as important as client education, and in a lot of cases, it's overlooked. Families often struggle to understand addiction, and that leads to frustration and anger and blame. So they may think that the individual is making poor choices or not trying hard enough. So by educating the families about the progression, we help them to see the bigger picture. And that reduces the blame and it improves the communication. And it also helps the families provide more effective support. When they understand what the person's going through, they're better equipped to respond in a helpful way. So family education also helps set realistic expectations. Recovery is not always quick or straightforward, and the families need to understand that. And as counselors, we can play a key role in facilitating those conversations and providing guidance. So I want you to take a moment to apply what you've learned. I want you to think about a specific client, either current or past. And I want you to identify the stage that they were in or they're currently in. Look at their behavior. What were their patterns? What are the consequences that they're experiencing? Can you see the progression? Are there points where maybe intervention could have occurred earlier? This is not about blaming yourself or blaming the client. It's just about learning. We want to consider what we would do differently, now with the knowledge that we've gained. How would you approach assessment? How would you tailor your interventions? This reflection is where growth is going to happen. It's going to help you refine your skills and improve your practice. So take your time with this. Pause the video. Ponder over this. The more you're engaging with it, the more valuable it's going to be. So as we're wrapping up this lesson, I want you to focus on a few key takeaways. Addiction develops over time, and it's following recognizable patterns. And these patterns can be identified early if you know what to look for. Early identification is going to allow for earlier intervention, which can improve outcomes. The timing matters. The sooner that we intervene, the more flexibility we're going to have. Another important takeaway is that recovery is possible at any stage. While later stages may require more intensive intervention, change is always possible. So as counselors, our role is to support that change and provide guidance along the way. So this lesson is not just about understanding progression, it's about using that understanding to improve your practice. So for your assignment, I want you to apply everything you've learned in this lesson to a real client. Start by identifying the stage of progression that they're in. Use specific behaviors and patterns to support your assessment. Then I want you to identify at least 2 risk factors that are contributing to their progression. Maybe it's biological, maybe it's psychological, maybe it's social. And then I want you to identify 1 change that you would make in your intervention approach based on this information. This assignment is designed to help you to move from understanding to application. So take your time with it, be as detailed as possible, pause the video here, and really get into the crux of it. And before you move on, I want you to just take a moment for a final reflection. Think about what stood out to you in this lesson. Was there anything that surprised you? Was there anything that changed the way that you think about your clients? And then I want you to consider how you're going to apply this immediately in your work. This could be a change in how you assess clients, or how you're communicating with them, or how you plan their treatment. Reflection is a critical part of learning, and it's going to help you internalize what you've learned and turn it into action. So just take a few minutes to write down your thoughts. So you've now completed lesson 4, and you should have a strong understanding of how addiction progresses over time. You should be able to identify stages and recognize patterns and apply this knowledge in your clinical work. This is a significant step forward in your development as a counselor. The more you practice these skills, the more natural they're going to become. And remember, this is not about perfection. It's about growth and continuous improvement. Keep applying what you've learned, and you're going to continue to develop your effectiveness as a clinician. In the next lesson, we're going to build on everything we've learned so far, and we're going to focus on relapse and recovery. We're going to explore why relapse happens, how to prevent it, and how to support long-term recovery. And this is going to tie together the disease model and the neurobiology and the progression in a very practical way. So just take a moment to complete your assignments and reflections before moving on. You are doing excellent work.